So I would like to start my presentation. The title, Comprehensive Health-Related Quality of Life Questionnaires, can be classified as comprehensive or disease-specific. Few studies have evaluated the influence of nocturia and sleep disturbance on comprehensive health-related quality of life using SF-8. SF-8 is one of the typical comprehensive questionnaires, a short version of SF-36. It includes 8 subscores and 2 summary scores. The standard national values are almost equal to 50, and the standard deviation is almost equal to 10. Using SF-8 may give us several merits. First of all, SF-8 is more practical than the SF-36 due to its simplicity, and SF-8 allows us to compare health-related quality of life between patients with different diseases and to make international comparison of the same disease. Controversially, comprehensive scales are considered to be less appropriate for assessing the effect of medical intervention compared with disease-specific scales. We investigated the influence of nocturia and sleep disturbance on health-related quality of life by the SF-8 in patients with nocturia, study 1. And we monitored health-related quality of life in overactive bladder patients with nocturia receiving treatment of anticholinergic agent on the SF-8 study 2. This is study design. In study 1, 184 patients with nocturia. We investigated the prepared questionnaire with OABSS, PSQI, ESS, and SF-8. And in study 2, 51 patients, OAB patients, were administered imidafenacin for 12 weeks. And we investigated with the questionnaire, OABSS, PSQI, ESS, and SF-8 at every 4 weeks. This slide shows patient characteristics. Mean age is 70.9, diabetes, hypertension, and so on. With an increase of nocturia, the PSQI global score showed a significant increase. The percentage of patients with a PSQI global score over 5.5 also increased, and there was significant association. The PCS showed a significant decrease along with increasing frequency of nocturia. There was a negative association with an increasing frequency of nocturia for the PCS and these 6 subscales of the SF-8. The SF-8 allows us to compare health-related quality of life between patients with different diseases. In this study, the value of patients with nocturia are similar to or lower than those obtained patients with diabetes, hypertension, osteoarthritis, and cancer patients. The effect of imidafenacin on nocturia with OAB has been established, and the improvement of nocturia sleep disturbance and health-related quality of life have been reported. So we used imidafenacin as medical intervention to monitor the change of SF-8 score. This slide shows in study 2 patient characters. Mean age is 72.6, diabetes, hypertension, so. Compared with the baseline value, treatment with imidafenacin significantly reduced the nighttime voiding frequency at 4, 8, and 12 weeks, respectively. The PSQI global score was 6.51 baseline, whereas the score decreased. The PSQI component scores for sleep quality and sleep latency were also significantly improved. The PCS was 39.5 before imidafenacin administration, and it increased significantly after 8 weeks administration. The MCS was 47.5 before administration, and it increased significantly after 8 and 12 weeks. In general, comprehensive scales are considered to be less appropriate for assessing the effect of medical intervention compared with disease-specific scales. However, the therapeutic effect imidafenacin was detected in the present study was SF-8, a comprehensive scale. The SF-8 can be used to monitor health-related quality of life in OAB patients with nocturia receiving treatment of anticholinergics. In conclusion, the SF-8 investigation showed that nocturia and sleep disturbance have a major influence on comprehensive health-related quality of life as well as other chronic disease such as diabetes, hypertension, and even cancer patients. Thank you for your attention.
Thank you. This paper is open now for discussion. Any questions, comments? Can I just make a quick comment? How would you explain that this general quality of life questionnaire was sensitive to change in treatment outcome in these patients?
Various sleep disturbance and quality of life. So, nocturia and sleep disturbance have major influence. So, complaint with nocturia, influence quality of life. So, in this study, we explain the patient with nocturia. So, influence quality of life. So, explain.
So, in patients with nocturia, general,
yeah.
Quality of life questionnaires will be sensitive to the treatment outcome using anticholinergics? I mean, this is my question.
Sensitive?
Yeah, because usually, you have to use a disease-specific quality of life to measure treatment outcome. That's my explanation. Thank you.
Thank you.
Any?
Yeah.
Yes, please.
Ruud Bosch from Utrecht, the Netherlands. When I look at your effect of the anticholinergic treatment on nocturia, it is actually very small.
Yeah.
So the decrease in nocturnal voiding frequency is very small. So it is kind of surprising that you measure this by a quality of life questionnaire. But I think the explanation is that any intervention given to a patient will lead to an improvement in quality of life. So a study like this, I think, can only be valid if you compare with a placebo group.
Yeah.
So the question is, why did you not enter a placebo group in this study?
So already in this study, we tried our hospital. So our hospital is university hospital, so biggest. So no complaint patient. We have no patient. So we can put placebo. So next study, we put placebo.
Okay, thank you. Paulo?
Yes, Paulo Palma from Brazil. My question is, when you compare with propivarin, we have 2 formulations and 4 dosage. So what's the formulation and what dose of propivarin do you use to compare the non-inferiority study?
Oh, sorry, excuse me.
Propivirine,
Propivirine.
the dose and the formulation, because there are many different doses and formulations to compare.
Compare, we don't compare.
No, you said that, sorry, the use an anticholinergic that's not no inferior to propivirine. In what dose, in what formulation?
From this study?
Yes.
Oh, I don't.
Thank you.
No.
Any further questions? Comments? Well, thank you very much.
Thank you.